Hello, this is Lisa Criscione-Schreiber, and I am happy to tell you about our DEI curriculum initiative funded by the Arthritis Foundation. We had several goals of the curriculum that we developed. The first was to educate future physicians about race and ethnicity-associated healthcare disparities in rheumatic disease care. Our second was to help describe ways that individual providers can address and reduce unconscious bias in healthcare delivery. And our third curriculum goal was to convey the rewards of practicing rheumatology to medical students, especially as it pertains to advancing healthcare equity, to try to help attract individuals from underrepresented in medicine backgrounds to rheumatology. So we used a variety of methods to meet our goals. The first, which I will describe, is that we developed podcasts, which were distributed through RheumMadness, and I'll tell you about that. The next was that we developed RheumSim Cases that addressed some healthcare disparity-related issues, such as in a case of lupus nephritis in a patient with low health literacy and low health numeracy, and another case with rheumatoid arthritis in which financial concerns adversely impact the ability to reach treat to target. And then our last method was to address DEI education goals at a Carolinas Fellows Collaborative Winter Conference. So first I want to tell you about RheumMadness. RheumMadness is a collaborative online learning event that was created by Dr. David Leverins, who's one of my collaborators on this project. And I listed the website there below, as well as the logos for the first, second, and pending third season. What RheumMadness is it's designed similar to March Madness with brackets. And instead of the traditional teams that we think of in a sports tournament, each team is actually replaced by a concept. And I'm just showing you the brackets from 2022. There were 4 different regions, kind of like the North, South, East, and West, and they're listed here. And within each of these regions, there was a scientific topic. So for example, anti-net antibodies. And in this, what happens is that each topic is picked up by a group of people who write what's called a scouting report. And it is just what you would think of, like you read a scouting report about a sports team, where it would describe the data in support of, for example, anti-net antibodies being the most important concept that was covered. And they describe it, and they can make it as funny as they would like, and they can include references. And then basically what happens is that with these topics as teams, we have a leadership team for RheumMadness. And what the leadership team does is create a number of podcasts where we will get together and discuss the scouting reports and the concepts. And really often we'll get the people who wrote the scouting reports on the podcasts, and we will talk about the implications of that particular topic. And then RheumMadness also named a blue ribbon panel. So we have a blue ribbon panel every year, and they are actually the ones, they're kind of the referees, I guess, but they decide on who wins each matchup. And they can decide this, in discussion. They take a vote, and they basically examine the merits of each of the concepts and look at the data and read the scouting reports and make comparisons. So then based on the matchup winners, they determine an actual winner of the tournament. So in 2022, our team created 9 different podcasts. And I have highlighted that what we chose to do was to actually make diversity, equity, and inclusion a topic within several of the podcasts. So for example, in each of the region podcasts, we talked about DEI. So for example, in 2.4, which was one of the earlier ones in February, we talked about disparities in osteoarthritis and gout. In the one on March 3rd, we talked about disparities in pediatric rheumatology. And on March 10th, we talked about disparities in reproductive health care and rheumatology. So in that way, rather than having just specific podcasts or topics that were focused on DEI, we actually did what we think is really important, which is to weave discussions of diversity, equity, and inclusion into everything we do. And so we actually wove it into a number of different podcasts and talk about it frequently. The second part of our curriculum was to develop a couple RheumSim cases. And what I've shown you here is the landing page for RheumSim. And RheumSim was actually created by Stacy Bagrova, who is currently a rheumatology fellow at the University of South Florida. And when she started working on this, she was a medicine resident at Duke and was working with me on several different education projects. And the website is very simple. It's at the bottom right. It's RheumSim.com. And if you go to RheumSim.com, you will see this, which is the landing page. Welcome to RheumSim. And as you go through, how did we make it happen? Like I said, we had Stacy Bagrova. The first thing that we had was a curriculum on making infusion reactions. A curriculum on how to treat infusion reactions and manage them. And then we met up with Dr. Matt Sparks, who incidentally is also the creator of RheumMadness, which is similar to RheumMadness. He suggested we help create RheumSim. We were able to meet up and work and collaborate with Dr. Samira Farouk, who is a nephrologist who agreed to collaborate. She's the person who started NephSim. And we learned how to use the platform. We started creating content, and we have reviewers who review and edit our content. So when you go to the RheumSim site, this is what you get. And the first thing you can do is you can pick your case. Right now we have 3 cases. Our DEI cases are still in edit and review. But basically, just as an example, if you decided to pick case 1, you would go to the introduction, which gives you a history of present illness and talks about the patient presentation. Then you'll go on to a variety of questions and different information about the case. And so, for example, in this one, the final diagnosis was polyarticular gout. And there's a little bit of learning here at the end that the student or whomever is doing the cases can read about. So additionally, through RheumSim, we have some diagnostic schemas about the approach to vasculitis, the approach to joint pain, and a tutorial about ANA. So for example, we have some one-pagers that describe approaches to different topics in rheumatology. So like I said, we haven't gotten this one approved and edited and put into the final format yet, but this is the RheumSim case, which is basically it starts off as a 22-year-old woman who comes in with a lot of edema and poor energy and some other symptoms suggestive of lupus. And as one goes through the case, you find out that the patient was hospitalized for a renal biopsy to be performed and was started on a number of medications that, for those of us who do any work in rheumatology, sound pretty straightforward, but could be pretty daunting for a patient. So for example, what we've discussed is that the patient was started on prednisone, 60 milligrams daily, with plans to continue for 3 weeks and then taper to 40. She was started on hydroxychloroquine. She had lower extremity edema and hypertension, so she was started on furosemide and lisinopril. And this was a 22-year-old previously healthy woman. And then after she's discharged, her biopsy comes back and you prescribe mycophenolate mofetil. And these are the instructions that are given to the patient. And then the case goes on and says she returns to see you in clinic 4 weeks later. She says she's not feeling any better. Her weight is now up several kilograms. She is hypertensive and she has moon phases and 2+ pitting edema to her knees. So our question is, what's at the top of your differential diagnosis? And we have a number of different possibilities, but the answer is medication non-adherence. And so what we learned basically is that the patient had low medical health literacy, as well as health numeracy, and she was not taking her medications as prescribed because she didn't really understand the instructions. So in summary, the first part of this RheumSim case was to diagnose lupus nephritis, and give the individual doing the case a discussion of lupus and lupus nephritis. And then part 2 of the case was the treatment failure, which was really because of low health literacy and low health numeracy. And in our educational portion of this case, we'll be explaining the concepts of health literacy, health numeracy, and giving people ideas on how to assess these and how to address them. So the third component of our curriculum is to address DEI education goals at the Carolinas Fellows Collaborative. And we started this in 2022 at the Carolinas Fellows Collaborative Winter Conference. And this is a collaboration between the rheumatology programs in North and South Carolina. And we hosted the program in 2022. And Dr. Kai Sun, who is a researcher who researches medication adherence, especially in lupus, she actually gave a talk about adherence barriers in lupus. And our Duke Fellows designed a session where they talked about cognitive error in rheumatology. And some of cognitive error has to do with how we prescribe medications, as well as when we anchor on the wrong problem and don't necessarily realize that some of the problems that patients have are with taking the medications that we prescribe appropriately. What we're planning for March of 2023, when the Fellows Conference will be at UNC, is a didactic on disparities in healthcare outcomes in rheumatology. And then what we're going to have is some guided small group work focused on how our individual fellows can make a difference and how they can address disparities in daily practice. And additionally, we're going to make sure that we talk to the fellows and train them in being able to teach about addressing rheum healthcare disparities when they're working with students, residents, and eventually when they're in practice, when they may be teaching others. So the last part of our Arthritis Foundation grant is the clinical track. And this is where we are planning on sponsoring up to 3 visiting medical students to come to Duke to do a month-long rotation in rheumatology. And our plan is that this will be a combined adult and pediatric rheumatology rotation. Their first week is going to be spent as adult rheumatologists, actually their first 2 weeks. And they will attend all the adult rheumatology didactics. In the first week, they will be in the adult rheumatology clinics, which include our pregnancy, scleroderma, lupus, and musculoskeletal ultrasound clinics, where they will get a lot of clinical exposure. In week 2, they will round in the hospital in the adult consultation service. For weeks 3 and 4, they will be on the pediatric rheumatology rotation, where for both weeks, they will attend all the pediatric rheumatology didactic sessions, and they will do a mix of pediatric rheumatology clinics and pediatric inpatient rheumatology service. We have not yet enrolled any students in the rotation, partly, I think it was really because of the timing of the grant and being able to offer the rotation to students. Just based on when it started, it wasn't at a time when we could recruit students very well, but we are working actively on recruiting right now so that we can get some students to join us in the early spring. So I would like to acknowledge and thank the Arthritis Foundation for supporting me in this work. I'd like to thank my colleagues and collaborators at Duke, Dr. David Leverins, Dr. Mithu Maheshwaranathan, who is the course director for the adult rheumatology rotation, and Dr. Rebecca Sadoun, who's the course director for the pediatric rheumatology rotation, and also the Carolinas Fellows Collaborative Program Directors from UNC, Medical University of South Carolina, Wake Forest University, and Massachusetts General Hospital. Thank you very much for your attention.